Hello, citizens of Corona. I'm your mayor, Jim Steiner. I'm here today with City of Corona Fire Chief Brian Young, who has a new collateral assignment, and that is the Emergency Services Director for the City of Corona. He's overseeing, taking the lead on the COVID-19 outbreak. Chief, thank you for taking some time to be with us here this morning. I know how busy you are, so thank you. Chief, can you explain in more detail what the Safer at Home order actually means?
Sure. You may recall Governor Newsom put out his executive order stating that citizens of the entire state of California were safer at home. It's basically a nice way of saying stay home during this situation. Early into this situation, we were told that social distancing, washing your hands, not coughing outwardly, doing all of those things that we're hearing over and over, which are great things to pay attention to, was followed up with the Safer at Home executive order. And really what that was to tell people that in order to stop the exponential spread of this virus, we need to limit unnecessary exposures, and we do that by staying at home. Obviously, we know it was defined that you can go out and get food. There's obviously essential components of the government that are staying in place, as well as essential components of business. But all in all, those that are not party to an essential function really need to heed the order, stay at home. It's much safer, it mitigates the spread, and it really will help us conquer the spread of this virus.
Great, thank you. Our residents are doing a really good job of following the mandates, but not all. And some, I think, don't necessarily understand the significance of the social distancing. While we are encouraging our citizens to get out into the fresh air and walk and hike, when you do that, you still have to maintain that 6 feet to try to flatten that curve. So, as early as this morning, I think more beaches and trails are being closed throughout the state. And it's because people aren't adhering to the 6 feet social distancing. So it could happen to us regardless, but let's not encourage that by not being responsible. Another one of the concerns I've been getting is they've been driving by parks and seeing kids playing on playground equipment. While our parks are closed to sporting events, they aren't necessarily closed to the family that wants to stop by and play on the equipment. However, you got to use a little bit of common sense here. I wouldn't want my toddler playing on the playground equipment when I don't know when it's been sanitized. We don't have the staffing to go sanitize
Correct.
Our parks every day. So, sure, go to your park, walk around the park, but man, if you're going to let them play on the equipment, at least do your own personal sanitizing ahead of time. I wanted to touch a little bit more on planning. So as firefighters, we've spent our career teaching kids and families what to do in an emergency, what to do if you're laying in bed at night and your smoke detector goes off. You don't sit up in bed, you roll out of bed, you crawl the door, you fill the door. If it's hot, you go to your window. If you got a window ladder, use that. And then, meet. Where are you going to meet? You've discussed this as a family. Where are you going to meet? We're going to meet at the tree in the front yard, so I know my whole family's out, and we're going to call 911. At the last council meeting, you did a really good job explaining how to plan. What should families do to plan in case them or one of their family members contracts COVID-19? Can you touch on that again?
Yeah, absolutely. You touched on a little bit as far as what we have done in the fire service, or actually all of public safety for that matter in the past, is planning for inevitable events. We do it with wildland fires, we do it with earthquakes. It's just a good business practice. Well, this is no different. Is plan now, not later. So there's a significant portion of the population that are at risk by the definition of the CDC. They're over a certain age demographic, they may have pre-existing medical conditions. Well, if that is you should have already addressed what you're going to do if somebody in your family comes in contact with the virus and is under a 14-day county ordered quarantine, or if they test positive themselves. it shouldn't be after that occurs that you're trying to figure out what to do. So something as simplistic as defining which room in your house will be where the self-quarantine will take place, and having that discussion with your entire family. And then also having the reinforced discussion is, if this does take place, we are then going to need to maintain that distance at all times, even with members of our family, so we can isolate that. It's important to know that many of the people that are testing positive, that are not having significant symptoms, are actually quarantined at home as a positive patient. So that the termination level of when they literally go from quarantining at home to going into a medical facility is based on their medical condition. So everybody that's tested positive doesn't automatically go to a medical facility. So having that plan in place, having the discussion with your family, your loved ones, and people that are part of your support network is critical. It may be as simple as identifying that some of your family is going to go stay with a relative while you quarantine in the house by yourself. But not having those discussions early sets your family up for a situation where you don't have control of that situation. So I cannot urge enough to plan now, not later.
That's great advice. So what should our citizens expect when our firefighters and paramedics walk through their doors?
Great question. There's been a lot of social media push as far as visualizations out there as far as what various fire departments are going to be wearing. But just to make it clear to our citizenry, is at a minimum they're going to have eye protection and a respiratory mask on. So that's on all medical aids right now. We're not taking the chance of a vicarious exposure. Our resources are too critical to not make that prudent decision. So at a minimum you'll see gloves, eye protection, and a mask, and then on many situations they'll have some sort of outer garment or a gown. That will definitely be the requirement on a suspected COVID patient, but you'll see some semblance of mask, glasses, and gloves on all patients. And then the same thing holds true for our law enforcement partners. You'll see them with eye protection, masks, and gloves if they're having to support an incident that may require law enforcement in addition to the fire personnel. And
our dispatchers are trained too to gather that some pertinent information ahead of time and then relay it to the responding crew. So yep, they play a pretty key initial role in this for sure.
Vital role, yes.
Right. We've had just dozens offer their services, offer their buildings for us to use for whatever purpose. How are you managing all those offers for assistance?
That's a great question, Mayor. Early on when we stood up this operation, we were primarily doing with the operational components of response. Now this is what we would call, or I would refer to as the second wave of decision-making points that are coming into play. So you touched on it. Our faith-based organizations, our nonprofit organizations, our business community are all coming together to be incredible stewards and share their love for our community and want to be active participants in a solution. And what we recently did as a component of the Emergency Operations Center under the operations section is we've stood up the Care and Shelter branch. And what the primary objective of that Care and Shelter branch is, which is going fully functional today, is to coordinate with all of those various organizations, determine what resources are available, what offers of service they provided, and really create a coordinated effort so it's not a lot of independent action. The independent action is phenomenal because it's reaching the people in need. However, with lack of coordination, it makes it more difficult to share those resources and share the offers with the public as a whole. A couple other things are going to be coming online very shortly that will provide a mechanism to know what's available. One of those is a dashboard, a digital dashboard, not unlike what we already stood up for a COVID-19 response. But what this will do is, as a starting point, we'll have all food establishments in the city that have remained open. They'll be geolocated on a map. Their hours of service will be provided. And then additionally, the same holds true with all of the educational programs that have feeding services available for their students in the Corona-Norco Unified School District. Those will all be listed as well with the details of their food programs for their students and their families.
Excellent. You mentioned the EOC. Can you explain that a little bit more? We've just upgraded to level 2 activation, right?
Correct.
Can you explain what the EOC is just for the public?
So basically the Emergency Operations Center is the command and control coordination from the city's perspective. In the police and fire service, we have our department operations center that deal with the operational tactical issues, but the EOC is really looking at the city as a whole from a strategic perspective to make sure that our essential functions stay in service, and most importantly, we're able to provide services to the citizens of Corona. So just to give you an example of how it's built, there's some primary functions that take place in the EOC. There's a command staff that has a lot of key decision makers. And then there's the general staff, which is made up of finance, logistics, operations, and planning. So if you key on those primary words, you can it's kind of self-evident of what the intent of the EOC is and how we keep the process moving. One of the reasons we stood up to a level 2, which is a little higher than some of the other cities in the region is that we were starting to see an uptick in activity, a lot more needs from the community, and in order to meet those needs, we had to elevate what our response was to those desires.
Okay, and our fire department is currently 100% staffed?
Correct. So one of the things we're reporting out on a regular basis is staffing levels of police, fire, and DWP. Now, when we say 100% staff, that means that at that given time, we have staffing to respond to 100% of our normal numbers. Now, if you look behind the scenes, though, our total available number of responders, at least from the fire perspective, is a little bit lower, either due to attrition with current openings or actually people doing what they're supposed to do, is calling in sick when they're under the weather. Mm-hmm. So our total number of personnel is down, but our daily staffing is at 100% to meet the needs of the citizens of Corona.
Great. Well, Chief, I'll let you get back to work, but I just want to thank you so much for everything you're doing. City Manager Jacob Ellis was right on when he appointed you to this position to oversee the COVID-19 epidemic, and I just want you to know that I'm proud of you, and I know our community is as well. Having said that, there's a lot of information out on social media, and some people aren't on social media. So the best way to get updated and accurate information is to go to the city's website. It's www.coronaca.gov, and at the top of that homepage you'll see COVID-19 link. That'll take you to everything that we know about it up to this moment. And there's a dashboard on there that the chief and our IT had put together that is constantly updating what's going on in our community. And I would just urge you, that's where you get your official information from. So thank you all for doing what you're doing to do your part to try to slow the spread of this virus. We can do better though, and I guarantee you that if we don't maintain social distancing, that there will be further closures, and none of us want that, because I know we want to be able to go to the restaurants to get food. I know we want to go on hikes and walk with our families, and so let's not be told we can't do that kind of stuff anymore. So that's going to require all of us doing our part and taking this seriously. Thank you, and God bless.